Good afternoon, everyone. My name is Cristina Rodriguez, and I will be presenting an in-service today over the glucagon emergency kit. Before we get started, I'd like to present my audience.
Hi, my name is Dania.
Hi, I'm Zoya.
Dana.
Jocelyn. Trisha.
Thank you. So the objectives for today is I'm going to quickly go over the background about glucagon and the kit. And I'm going to also differentiate between hypoglycemia and severe hypoglycemia and how to counsel a patient on how to use the glucagon emergency kit. And lastly, I'll end the presentation with a summary and some resources for you guys. So, glucagon. Glucagon is a hormone that is released from the pancreas. And once it's released from the pancreas, it acts on the liver and releases those glycogen stores and converts it into glucose. Thus, once that process happens, it increases the blood glucose serum. So, because it does this, it's used to treat severe hypoglycemia, which hypoglycemia, we do see that sometimes in our diabetic populations, especially those who are on insulin or on those sulfonylurea medications. So this is what the glucagon emergency kit looks like. It has a vial that contains 1 milligram of glucagon powder and a syringe that is filled with liquid. Attached to the syringe is a needle as well. So does anyone know a common sign or symptom of hypoglycemia?
Dizziness.
Sweating.
Yes, exactly. So those are all signs and symptoms of... Sorry, we're having some technical difficulties. So those are signs and symptoms, just as you guys mentioned, of hypoglycemia, so sweating, shakiness, headaches, and typically we start to see those signs and symptoms whenever blood glucose is less than 70. So the difference between hypoglycemia and severe hypoglycemia is that with severe you'll see disorientation, unconsciousness, seizures and convulsions, and typically blood glucose will be less than 50. So in patients like that, whenever they have severe hypoglycemia, it's common to just find them unconscious, and it might look like they're taking a nap, but really it's just their blood glucose levels are direly low. So indications for when to use the glucagon emergency kit. So the kit should be used whenever the patient is experiencing severe hypoglycemia, so less than 50, and they're unable to eat or drink safely due to confusion or disorientation. So whenever they're experiencing that low blood sugar, they're unable to adjust it correctly by drinking soda or sugar. So also you should use the kit if you find if you're unconscious or if you're having seizures. So because of this, it's really important that those patients who have these kits inform their family members and friends on how to use the kit, since since the patient will be unconscious, they will need someone else to administer it for them. So how to give the glucagon injection. First and foremost, you want to make sure that the patient always checks the expiration date before administering the injection. So basically what they're going to do is open the kit, flip off the cap as shown in the diagram, and inside will be the powder. So what they will have to do following that is remove the cap from the syringe and insert the needle into the vial. Once the needle is inserted into the vial, they can push down the syringe plunger and it'll inject all of the fluid that's in the syringe into the vial. So once this is done, you want to tell the patients to gently shake it or roll it so to make sure that they mix that mixture of liquid and powder. They want to make sure that it's completely dissolved and that the solution is clear. So once they see that the solution is clear, they can go ahead and draw up some of the glucagon in the syringe by pulling the plunger down like so in the picture, and they want to make sure that they draw the entire medication into the vial so they get that whole 1 milligram of glucagon. However, if you're administering for a child, you want to give half the dose. So when it's time to inject the glucagon, the patient has the option of either injecting into the patient, the family member has the option of injecting to the patient's buttocks or thigh area. So if they're able to and they have access to a swab, it's recommended that they first clean the area. However, because this is an emergency, if they're unable to have access to that, it's okay to just go ahead and inject the glucagon. So when counseling our patients, we want to make sure that we instruct them to make sure that the needle remains 90 degrees and that they push the entire plunger all the way down so that the patient is able to receive the full dose of glucagon. So when the syringe is empty, they want to pull that needle straight out of the skin, and right after they're done injecting the patient, they want to make sure that they put the patient on their side, because sometimes one of the common side effects of this medication can be vomiting. So we want to make sure that they're on their side so they don't choke on their vomit. And next, they will want to make sure to call 911, and if the patient's awake or if they're able to check the patient's blood glucose to see that if it's rising within 15 minutes. And it's also important to counsel them that after they're done with using the glucagon kit to make sure that they dispose of the liquid, it's only a one-time use. So like I said earlier, some of the common side effects is vomiting. They can also experience nausea. However, most people don't experience any side effects using glucagon emergency kit. So lastly, we're going to end the presentation on summary and some resources. So we want to ensure that whenever we counsel our patients that we emphasize how important it is for them to educate their family members, their co-workers on how to use the glucagon emergency kit, because they will not be administering it themselves. They will need the aid of someone else to help them. So with that being said, it also may be a good idea to get 2 prescriptions from their doctor so they can have an emergency kit located at home and at work. Also, we want to make sure that they always check the expiration date before administering it. We never want to use expired glucagon. And lastly, after administering the patient with the injection, they want to make sure they turn the patient to the side and call 911. So some resources that you guys can use are located at lilyglucagon.com and at glucagonhypokit.com. They have instruction cards that have directions and photos of how to use, so you can print them out for your patients and they can keep on hand with them. And here are my works cited. Oops. So, do we have any questions?
Yeah, I just have one question. What are the contraindications for the glucagon?
So, the contraindications in patients are patients that have known hypersensitivity to it, or also patients who have phenocheirocytoma. So that is a rare tumor of the adrenal gland, and it results in the release of too much epinephrine and norepinephrine. So it's only contraindicated in people who have hypersensitivity and have that disease.
All right. Cristina, I wanted to see, do you think can it be used in pregnancy?
So there aren't exact reproduction trials for the use of glucagon in pregnancy. It has been studied in animals such as rats, and it's been safe. However, because of the lack of evidence and it's unethical to test in pregnancy, that we really recommend not using it unless it's an emergency situation. So if you find maybe a diabetic pregnant woman that is unconscious and not responding.
Thank you.
I know you said that you get multiple prescriptions, so I was wondering how much would this kit usually cost?
So unfortunately, the kit does run around $300. However, I really do encourage community pharmacists and technicians to go on those manufacturing websites to find coupons and saving cards for patients to utilize.
All right, my question is, how do you store it?
So the glucagon kit, you want to make sure that you store it in room temperature. And so you want to avoid places like your bathroom or anywhere that's hot and humid.
Okay, thank you. And so after a patient administers the glucagon, how long does it take to work?
So the half-life of glucagon is around 8 to 18 minutes, but for patients that are unconscious, you should be able to see a response within 15 minutes. Thank you, everyone.